Everyone knows the symptoms to the common cold: stuffy nose, sore throat, aches. Would you be able to tell if you had just the common cold or something worse? A girl in my biology class last semester assumed she had just another cold, until she woke up one morning dizzy and almost blacking out. When she finally went to the hospital, she was dehydrated and stuffed up. She could barely breathe. When she was finally told what was the matter with her, she was stunned. To Anne's disbelief, she had swine flu, not just a common cold. For the next couple of minutes, I will give you information about swine flu. I will explain the symptoms and what can be done to treat them. I will also discuss what the negative effects can be if you have a pre-existing respiratory disease. Lastly, I will outline ways to help prevent the contraction of swine flu. I will begin by discussing what the symptoms are and what some of the possible treatments are. Swine flu can be deadly. It is important to educate yourself on how to prevent contracting the illness. Swine flu, also known as H1N1, is a respiratory infection that shares many of the same characteristics as the common cold. Some common symptoms of swine flu include fever, sore throat, cough, ache, chills, and fatigue. The World Press Administration says the best way to distinguish between a common cold and swine flu is if respiratory problems are accompanied with flu symptoms. According to the World Press Administration, people with pre-existing conditions such as asthma and emphysema are more vulnerable to swine flu. There are many options for treatment of swine flu. MedicineNet reports the best way to treat swine flu is to get the vaccination. People aged from 6 months to elderly men and women are approved to use this vaccination. Pregnant females are also allowed to use the vaccination. MedicineNet also reports there are 2 antiviral drugs that an infected person can take: Relenza and Tamiflu. Viral resistance can occur if taken too long. These should not be taken if the symptoms have been around for more than 48 hours, unless in a hospital. Managing a pre-existing respiratory disease along with swine flu can lead to further complications. Coupling respiratory disease with swine flu, which is a respiratory infection, can be a lethal combination. According to the Centers for Disease Control and Prevention, people with asthma are at a higher risk of contracting the disease and possibly developing pneumonia. Everyone above the age of 6 months who has asthma is recommended to receive the flu shot. Persons with flu-like symptoms need to speak with their healthcare provider as soon as symptoms appear to begin taking the antiviral prescription Tamiflu. I will now discuss what you can do to prevent contracting swine flu. Now that I have discussed what to look for when deciding whether you have swine flu or not, I will inform you on ways to protect yourself and prevent contraction. The California Department of Health recommends covering your mouth, washing your hands, and most of all, stay at home if you are sick. Keep a healthy immune system by eating healthy and exercising frequently. Dr. Emily Kane reports that taking precautions to prevent proliferation while you're still healthy is a great way to prevent swine flu. Gargling salt water helps prevent proliferation. Cleaning your nasal cavity at least twice a day helps bring down viral population. Drink plenty of warm liquids, including tea, coffee, etc. This washes away viruses in both the throat and the stomach, because viruses cannot survive in the stomach because of the low pH levels. Swine flu is very harmful to a person's health. Although the pandemic peaked in 2009, there are still strands that can negatively affect a person, so educate yourself on the prevention of swine flu is crucial. It is with this thought I bring my speech to conclusion. For the past several minutes, I have provided you with information about swine flu. I have discussed the possible symptoms and possible treatments available. I have outlined what can happen if you have a pre-existing respiratory condition and the dangers involved, as well as different ways to prevent contracting swine flu. Anne made it out of the hospital a few days later, a much wiser young woman. She was put on antiviral medication and after a couple of days began feeling like herself again. Whenever one of our friends says they are beginning to feel sick, Anne always tells them to go straight to the doctors, because you never know what type of illness could be affecting you.